Have you ever heard of a pre-admission testing nurse? Because honestly, I had never heard about that role until my friend told me about it. And I currently do work as a pre-admission testing nurse, so I want to tell you guys all about it so you don't miss out on these opportunities that are beyond the bedside. And I'm honestly so excited to finally make its own dedicated video to this specific nursing role, because I've made videos about it before, but it's been in vlog style, but never a sit-down video. So I'm so excited to share with you guys this specific video. Now, a pre-admission testing nurse is a nurse who can either work at a hospital or at an outpatient surgical center. And I do work in this department per diem status. It is an outpatient job. So I do work 8 hours. It's an office job. So I'm sitting at a desk all day, every day, typing away, and I'm pretty much on the phone. So honestly, truly, I am enjoying this job. I think this is a job that I wish I would have known about in the past. And honestly, I had never heard about a job like this in nursing school. I feel like in nursing school, they just tell you about all these bedside jobs that you should work in, but they never tell you about all the other different nursing opportunities out there, which is why I share all these videos. I've made a video like this for primary care clinic, for my utilization review nursing job. So if you're interested in any of those nursing roles, I'll link the videos down below. But let's get started with my pre-admission testing nurse role. So first of all, because I do work per diem status, I pretty much just get assigned patients who are usually being added on to the schedule like a day or two before the surgeries, and I'm pretty much there to obviously assist the full-time nurses who are working there. So as soon as I walk in the morning, the secretaries will give me charts. Our goals are to complete 8 to 10 nursing charts. I've been working in this specific nursing role since January, so it's been about 11 months now, and so far I really like it. Now, the first thing I would do is I review the doctor orders. So usually they'll give us like the order, so we have to make sure that we check that the patient's name is correct, like it's spelled out correctly, the date of birth is correct, the consent to read is correct. And if anything is wrong in those physician orders, then we usually have to call the doctor's office and obtain them. And then if we don't obtain them, then we ask the secretaries to follow up. Now, with that being said, sometimes there are mistakes that are actually wrong in our system, such as the patient's name may be wrong and we have to change that. Or like if the date of birth is wrong in our hospital system, then we have to change it. So we pretty much have to make sure that everything is correct, not only in the physician orders, but the surgery schedule, and we compare that and make sure it's correct. And if either one is incorrect, then we have to follow up on it, either whether it's going to be with the doctor's office or we follow up with the scheduling department so that they can fix it. And usually then the secretaries will follow up with any documents that are needed from the doctor's office if we were not able to obtain them. So after I make sure that all the documents are right, then I go ahead and call the patient. So I am on the phone all day, every day with patients, and if I'm not on the phone, it's because I'm charting. So we do very extensive telephone assessments of patients' medical and surgical histories. So because these procedures that are being done at our facility are elective, we pretty much do very extensive because we don't have like an ER or an ICU. So I always try to be as detailed as I could be to try to get as much information as I can from the patient while I'm doing the telephone assessment. Sometimes it's a little hard to get information out of the patient because you'd be surprised. There's actually some patients that are not familiar with their own medical surgical history. Like they just don't know. Some patients don't even know like what their medications are for. So yeah, it can be a little tough, but that's when your like critical thinking skills come in and you start to ask the appropriate questions, and then it feels like you're just becoming a detective during the call because you have to make sure that you ask the correct questions, and if they don't understand the way you're saying it, you kind of have to word it differently so that they understand. So yeah, I feel like most of the time we're like detectives trying to figure out all this information that they're trying to tell us and they just don't know how to tell us. So we kind of have to like really probe and ask the appropriate questions in order to get the information that we need. And while we're doing the assessment and when we review the orders, we make sure that if any labs, EKG, imaging were ordered, that we ask the patient whether all of that was done. If it was, then we make sure we obtain it and that it's ready to go for the surgery day. If it hasn't been done, we instruct the patients to go do their labs, and just to make sure that everything is in place for the day of surgery, because you don't want to be obviously like having the patient come in and then orders are wrong, labs are missing, which still like labs can be done the day of surgery, they can, but it's better to just kind of have the patients come in before that so that everything is just ready to go and there's no setback. And before I forget, once we finish the assessment, at the end of the call, we will give them pre-admission instructions, which include like you cannot eat, like NPO after midnight, NPO 6 hours. Like if they're going to be staying inpatient status, we tell them to bring an overnight bag, etc. So we give them all those instructions before we hang up the phone, as well as giving them their time of arrival for the procedure. We then decide if we have to get the cardiology workup or not, based off of the procedure that they're going to be getting. Once it's reviewed, if I happen to find that on the stress test or on any, like on an EKG, it has like ischemia, infarct, or there's specific words on there that just don't seem right, or like the ejection fraction is like super low, we compare those results and we go through our anesthesia protocol, because we do have a protocol that we follow, and based off of that protocol we figure out whether the patient needs to be passed to the anesthesiologist for review. And then once it's reviewed by the anesthesiologist, they will decide whether the patient is truly a candidate for our facility or not. If they are not, then we, as a nurse, we call the doctor's office, talk to the surgery scheduler, and we let them know like, hey, I'm sorry, but this is why the patient cannot come to this facility. And then they will be the ones to let the patient know. And once we finish the assessment and we've obtained the height, weight, allergies, we send an email to the pharmacy letting them know that our assessment is complete and that all the information they need, including the doctor's orders, are there, so that they can get the medications ready for the patient's surgery for the following day or whenever the patient is scheduled for. Now, something else that we do as well is we call patients the night before their procedures to let them know if their time of arrival has changed for their procedures. If that is the case, then they will receive a call the night before and they'll get their new time of arrival. So as pre-admission testing nurses, we just make sure that everything is already in the chart for the day that the patient comes for surgery, because the worst thing scenario would be that a lot of things are missing and then the patient is canceled, and then there's gonna be really upset people. Probably the surgeon will be upset, and then it's like they could have fit another patient into that slot, especially for those ortho cases that are like hour, 2 hours long. So that's why our role as pre-admission testing nurses is very important. We really try to make sure that everything is in place and ready to go for the day that the patient does come in for surgery. So if you guys have any questions, please make sure to comment down below. I would love to answer any questions for you. And I will see you guys on my next video. Make sure to like, subscribe, ring the bell for notifications, and I will see you guys on my next video.